Bismillahirrahmanirrahim. In this lecture, we will discuss about mainly the anemia. You see many people in your surroundings suffering from the anemia. It is one of the most common disorder, and because we know that we come in the developing countries, and anemia is most common in developing countries due to poverty and lack of services. Now we discussed that what is anemia. Anemia is actually the decreased oxygen carrying capacity of the blood. Okay, so anemia is the decreased oxygen carrying capacity of the blood, or you can say that there is the reduction in the total circulating red cell mass. To diagnose anemia, usually we ask the patient to get checked simply the CBC. We prescribe the CBC complete blood count, and in that we mainly focus upon the hemoglobin concentration and the hematocrit. Hematocrit, it is the ratio of the packed red cells to the total blood. So in anemia, when the red cell mass would decrease, there would be the decreased number of red cells. So ultimately the hemoglobin would also be decreased, and the hematocrit would also be decreased, because it is the ratio of the packed red cells to the packed red cells to the total blood volume. So what we will see that hemoglobin is also low and hematocrit is also low. But there are few exceptions, in which case that we cannot rely upon the hemoglobin concentration and hematocrit. They could be falsely elevated or falsely low. What are those conditions? Either when there are the changes in the plasma volume. Changes in plasma volume. So what could occur? Either there is the fluid retention in our body, various causes in CCF, congestive cardiac failure, or if there is a chronic kidney disease, the patients begin to retain the fluid in their body, or there is the dehydration. If the patient is suffering from diarrhea, vomiting, then he may develop the dehydration. In these two conditions, if there is a fluid retention, what would be the result? There would be the hemodilution in the body. So, and when you will get the CBC checked, the hemoglobin concentration would be falsely low, and hematocrit would also be falsely low. Even though the red cell mass is like the normal individuals, it is within the normal range, but due to the hemodilution, you will see that his hemoglobin and hematocrit would be falsely low. In the same case, if there is the dehydration, when the fluid volume is lost, okay, fluid volume is decreased, then what would occur? Falsely, the hemoglobin and hematocrit would be raised, even though the red cell mass is like the normal individuals. Okay, so in these two specific conditions, we cannot what you can do in these conditions, you have to prescribe the multiple series of CBC, and if again in the repeated periodic CBCs, you find that their hematocrit and hemoglobin is low, even only then you can say that this patient is suffering from the anemia, because it may be that at that stage the patient is suffering from fluid retention, and falsely there is the hemoglobin is low. Now one thing should be very clear, that anemia, it is not a disease. Okay, it is not a disease, it is actually a symptom. It is a symptom of various disorders. So whenever you come to know that this patient is suffering from anemia, you should investigate that patient thoroughly, that what could be the underlying cause of this anemia. because it is just only a symptom. So and next we will discuss about the classification of anemia. Classification. Anemia is classified either on the basis of morphology or either on the basis of the underlying mechanism, or there could be the various bases on which you can classify anemia. The most common basis on which we classify anemia is on the basis of morphology. On the basis of morphology, and in morphology what we consider the red cell size, we consider the degree of hemoglobinization, and we consider the shape of RBCs as well. So red cell size, on the basis of morphology, what could be the red cell size? Either the size RBC size is like normal, like a normal RBCs, so it would be called as normocytic, or its size would be decreased, it would be called as microcytic, or its size may be the increase as compared to normal RBC, and it would be called as macrocytic. These are the three broad three broad varieties, either on the basis of red cell size, either it is normocytic or microcytic or macrocytic, and degree of hemoglobinization, it could be the normochromic, that hemoglobin is normal or hemoglobin level is low, so it would be the hypochromic. And shape, either there is a sickle cell shape, or there could be a spherical shape as we see in the hereditary spherocytosis. So in mainly on the basis of morphology, we classify anemia into the normocytic, microcytic, macrocytic, and either it is a normochromic and hypochromic. Usually microcytic and hypochromic are seen together, and normocytic or normochromic are seen together, and then macrocytic. Now there's a general rule that microcytic and hypochromic anemias, they are caused by the disorders of the hemoglobin senses. Disorders of the hemoglobin senses. Due to any cause, the senses of hemoglobin is disrupted, so you will see a picture of microcytic hypochromic anemia. And the most common cause in which the hemoglobin is not synthesized due to deficiency of the substrate, and that is the iron deficiency anemia. Whereas normocytic, normochromic are usually seen in conditions there could be the various causes, diverse etiology. Normocytic and normochromic anemia, there could be the various causes of these. Whereas macrocytic anemia, it is usually seen in conditions, in abnormalities that impair the maturation of erythroid precursors in bone marrow. That impair the maturation of erythroid precursors of erythrocytes in the bone marrow. And usually it is seen in vitamin B12 deficiency and hemoglobin, in which the DNA could not properly synthesize, and there would be the abnormal maturation of the erythroid precursors, because you know that erythroid precursors, they are larger than the normal RBCs, so those enlarged precursors would come in the blood, and you will see the picture of macrocytic anemia. Now we discuss a few of the examples of these. First is the microcytic hypochromic anemia. microcytic anemia, one is the iron deficiency, second could be the thalassemia. It is also the there's abnormality in hemoglobin synthesis due to genetic defect, and third could be the sideroblastic anemia. Sideroblastic anemia. In these three conditions, you will see the microcytic picture. Whereas in macrocytic anemia, either there is a megaloblastic anemia or there could be the non-megaloblastic anemia. Megaloblastic and non-megaloblastic. And in megaloblastic, there would be the vitamin B12 or folate deficiency, whereas in non-megaloblastic anemia, there could be the various causes, like if there is a cirrhosis or the patient is suffering from the alcoholic liver disease. In both these conditions, you know that erythropoietin is synthesized from the liver. So if the liver is defective due to cirrhosis or alcoholic liver disease, erythropoietin is not synthesized, so there would be deficient synthesis of erythrocytes, and you will see the macrocytic anemia. Similarly, in alcoholic hypothyroidism, the metabolism is slowed, so also you see the anemia. Whereas in normocytic normochromic, it is usually seen in the anemia of the chronic disorders like rheumatoid arthritis, like malignancies. In that conditions, various cytokines are produced that hamper the action of erythropoietin on the bone marrow, so there would be the normocytic normochromic anemia. So I repeat the classification of anemia on the basis of morphology, on the red cell size, degree of hemoglobinization and shape. And the red cell size, either it is a normocytic, that size of RBC is normal normocytic, or it could be the microcytic or macrocytic. And degree of hemoglobinization, either it is a normochromic or hypochromic. And in shape, either sickle shape or spherical shape, we will discuss later. Now we discuss the examples of these. The microcytic hypochromic anemia is usually seen in the disorders of hemoglobin synthesis, and the examples are most common examples of microcytic anemia is iron deficiency, or there could be a thalassemia, or there could be the sideroblastic anemia. Whereas in macrocytic anemia, there are two broad varieties, either it is a megaloblastic anemia or non-megaloblastic anemia. In megaloblastic anemia, there could be the vitamin B12 deficiency, and there could be the folate deficiency, which impaired the DNA synthesis. And in non-megaloblastic anemia, there could be the various examples, various causes like cirrhosis, like alcoholic liver disease, like hypothyroidism. And in the normocytic normochromic anemia, there could be the diverse causes, and the most important is the anemia of chronic disorders. So that was all about the this classification on the basis of morphology. Thanks a lot.